number of people being exposed to astronomical medical bills. We're talking about the coronavirus.
It's become common these days to see posters circulating online with people pleading for financial support for COVID bills. Right.
That's right. Now we're seeking to put a spotlight on why COVID healthcare is so expensive. Please go to www.citizentv.co.ke/coronabills. Again, www.citizentv.co.ke/coronabills, and share your experiences with us. Help us keep health stakeholders accountable. Speaking of accountable, we have here live in the studio Daniel Yumbya. He is the CEO at the Kenya Medical Practitioners and Dentists Council. Daniel, good to see you. Thanks so much for your time.
Asante.
You saw that feature, sir, right now. Very touching, very sad. What do families do tonight? If you have a family member in hospital tonight, what can you do?
First of all, I want to sympathize with the family or the families whose patients have been detained, having recovered from the ailments that took them to hospital. I would like to say that as a regulator, because we register and license hospitals in the country, we have made it very clear it is unethical. It has been put in the Doctor's Code of Professional Conduct and Discipline. And it is very clear that anybody detaining a patient because of lack of payment of bill is doing that unethically. It is also in the Constitution that the Constitution says that no Kenyan shall be denied emergency treatment. And the institutions that deny patients emergency treatment and institutions which detain patients upon treatment because of lack of payment is commit the same offense.
So it's illegal?
It's quite illegal and unethical. Therefore, it is true that patients are being detained. We have gotten reports. A number of patients have come to us as council, and I've given them letters directing the institutions to enter into an agreement with the families and release such patients. The cases that have been highlighted today, I will deal with them tomorrow. I'll send teams to the respective facilities. What I want to tell the families is that they should avail themselves in their respective institutions between 10 and 11 tomorrow. But that notwithstanding, I do not want to say that private-public partnership is not doing a good job to this country. There are private investors who have a lot of investment in healthcare, and therefore they also deserve to be paid for services that they have given. So I don't want to look like I'm leading on one side. But if a patient is unable to pay the bill and you detain the patient, the bill keeps on accumulating. As council, we say, agree with the family, enter into a certain agreement, give assurance. Some families have said that they have given logbooks, they have been rejected. I am directing the institutions to accept the sureties that are given by the families, because detaining them for longer will make the bill accrue, and at the end of it all, the family may not even be able to pay. But the government has also had a role to play to ensure that universal health coverage is covered. Kenyans have a challenge. We do not take health insurance seriously, because NHIF has introduced 3 types of insurance covers. One, they have given options to persons who would wish to get their super cover to pay 500 shillings per month. That is 6,000 shillings per year. And they get comprehensive coverage. I was in discussion with the CEO of NHIF this evening, and they said that just a small number has done that. So my appeal to Kenyans is that let them enroll themselves with the National Insurance Fund. They get that cover. Those who can afford the 500 shillings per month, be they in formal settlement, formal sector, be they be employed, let them ensure that they pay for the cover. If they do so, then we will have less of these problems. Those others who are working, they can also choose other insurances that are available. But the government has given the Linda Mama, that cover is there, that any woman who has got registration with NHIF, they deliver for free in whatever facility. The government pays for that, mostly in public facilities, but the Linda Mama, you have to register. Number two, the government through NHIF has given subsidy to orphans and vulnerable children. That subsidy is paid for by government.
All right, hold that thought.
Let me finish, Jeff.
Hold on.
We want to zero in on the NHIF issue because we're getting a lot of questions around NHIF, and we recently saw an announcement by NHIF that they're seeking to cut payment on renal dialysis, major surgeries, and diagnostic tests so as to cut costs. If they do this, then we're looking at a scenario of more patients being stuck in hospital. Are we therefore looking at tougher days ahead for Kenyans? And also the issue of the 500 Kenya shillings per month for the average Kenyan. Many would argue that this is a tall order.
Good. Two things. One, we shall not allow NHIF to cut arbitrarily without discussions. So the law establishes that NHIF, in consultation with council, shall appoint accredited facilities where patients can be reimbursed or they can get services. Therefore, for NHIF to make decisions that will affect Kenyans negatively, I would say the council will intervene, and we shall come up with a win-win situation where the patients will be taken care of. Remember, we guide the professionals and we protect the public. So in the interest of protecting the public, we shall ensure that NHIF shall not subject Kenyans to suffer.
In the meantime, the patients you just saw there, their families should avail themselves tomorrow between 10 and 11?
I would request them to avail themselves at the council between 10 and 11 tomorrow, and we shall take action to ensure that we facilitate their release from the certain hospitals where they are being detained.
Yumbya, that's some good news, at least for now. Thanks so much. Daniel Yumbya is the CEO of the Kenya Medical Practitioners and Dentists Council. Thanks so much for your time. At this point, we're going to take a quick break, come back. Plenty more ahead. Stay with us. A bit of politics, a bit of sports, and your feedback. Keep it coming. At Koinange Jeff.
At Lillian_Muli.
At Citizen TV Kenya, the hashtag is Sunday Live. Sunday Live takes a break. We'll be back in a moment. In the meantime,